Hello, everyone. Welcome to our webinar on the treatment of tendon injuries using your own cells. I'm Dr. Christopher Rogers, founder of San Diego Ortho Biologics Medical Group, and we are joined by my colleague, Dr. Mary Ambach. And we're excited to share with you some new treatment options that we use to treat patients with orthopedic conditions. And today we're going to focus specifically on conditions that affect tendons. I'd like to show you our office in Carlsbad. It's a new facility that was recently built, and the office specifically developed for the purpose of this new technology that we call regenerative medicine. And we knew that the field of regenerative medicine was going to play a huge role in the practice of orthopedic medicine, and so we wanted to design a special space that had all the services and facilities that we would need to accommodate these kinds of injuries. We have a state-of-the-art procedure suite here, and if you look on the right there, you can see what we call a C-arm, or a fluoroscopic unit, that is a digital X-ray that is used to visualize the spine and joints, as well as an ultrasound machine that we use for visualizing soft tissue. We have a state-of-the-art lab where we process various tissues such as blood or bone marrow or adipose tissue, which all contain cells that have been shown to be helpful for decreasing inflammation and regenerating tissues. We'd like our patients to realize that we take safety very seriously. We actually closed the office for 2.5 months during the height of the pandemic, but we are open now for patients who prefer to have a visit at home. We do offer telemedicine, but for those that need to be seen in the office, we want them to know that all staff members are tested regularly. Our patients are screened by phone to make sure that they have not been exposed to anyone who may have COVID. We do test patients in the office with temperature checks, as well as perform antibody testing for patients who are at higher risk. And then we also minimize the number of patients in the office. So typically you won't see anybody else in the waiting room when you visit us. The surfaces are sanitized between each patient. And we also disinfect with ultraviolet light, which has been shown to reduce the viral burden in the room. So that's what ultraviolet light looks like. So I'm board certified in physical medicine and rehabilitation, which is a non-surgical specialty in musculoskeletal medicine. I'm fellowship trained in what's called interventional pain management, which involves performing procedures in the spine and in the peripheral joints to minimize the need for surgical procedures. I founded this practice about 3 years ago, and I've been in practice for 20 years. I'm a San Diego native, and so I was very pleased to be able to continue to spend my professional life here in San Diego and service the people of San Diego. Dr. Ambach is also board certified in physical medicine and rehabilitation, as well as pain medicine. And she has completed fellowship training in regenerative medicine and Ortho Biologics, which is pretty rare in the United States. She brings 12 years of experience, and I actually met Dr. Ambach when we were lecturing at medical conferences around the country, and was impressed by her interest in being an academic physician. Both she and I have contributed to medical journals as well as conducting scientific research. So as I mentioned, we like to lecture around the country, and there's just some snapshots from various conferences that we've taught at, and you can see we have workshops where we train physicians from around the world on some of the newer techniques that are used in orthopedic medicine. We have contributed to the published literature. These are some of the textbooks that are available for physicians to read. Currently, physicians attending medical school and residency don't receive a lot of training in regenerative medicine. And we wanted to contribute to the literature, and we were confident that someday this will be part of the regular curriculum. So in today's talk, we're going to focus on tendon injuries, or something that's called tendinopathy, as well as discuss some of the specific biologics that we use, such as platelet-rich plasma and cell-based therapies, Then we're going to take your commonly asked questions that we hear in the office, and then review some of the scientific studies that support the decisions that we make with our patients. If you'll save your questions till the end of this discussion, we'll tackle those at the very end as well. If you look at the bottom of your screen, you'll see a section that says Q&A, and if you type on that, you will be able to type in your question. If you have any specific personal questions, just say you have a personal question and we'll give you a call or email you, and we can address that personally, so you don't have to share your personal information. So a tendon, as many of you know, is a structure that connects your muscle to your bone. And so if you reach along the front of your elbow and bend your elbow a little bit, you'll feel a cord-like structure there, and that's a tendon. And that tendon is made of collagen fibers, which are essentially stronger than steel. They have tensile strength that is greater than steel. Nonetheless, they can still break over time. We can get these little micro tears in those fibers. And as we age and as we are active with sports and other activities, those tendons tears can increase and produce pain and loss of function. Also around the joint, you have other structures that can produce pain, such as the bursa, which is a fluid-filled sac that cushions the tendon as it runs over the bone. And that bursa can become inflamed, which is what we call bursitis. You can develop abnormal movement of the joint, which can lead to osteoarthritis, which is damage to the cartilage in the joint. And you can have injuries to the ligaments, which hold the bones together, and you can see pain as a result of any one of these structures in addition to the tendon. So in regenerative medicine, we talk about regenerating tissue, and that's based on the fact that your body has this innate ability to heal itself. And it's something that we all have taken for granted at one point or another, but it really is a remarkable process that scientists over the last 3 decades have begun to understand to a much greater detail than ever before, whether it's understanding our genetics or understanding tissue engineering. The concept of growing new tissue is really leading to the ability to offer treatments for patients. So that's what we're going to talk about next. So if you're a farmer, you need seeds and you need fertilizer and you need soil. Maybe you also need some water and sunshine to grow your plants. But as a physician practicing regenerative medicine, we sometimes feel like a farmer because instead of seeds, we have cells. Instead of fertilizer, we have growth factors. And instead of soil to hold those cells, we have scaffolds. So these are the different ingredients that go into regenerating tissue, and each of these have been studied extensively in the literature. And we call these Ortho Biologics. Our company name is San Diego Ortho Biologics, and Ortho Biologics refers to cells and molecules that are produced by cells. And these include things such as platelets, stem cells, growth factors, protease inhibitors, collagen, and fibrin. These are all different ingredients that we can find in your own blood or your own fat tissue or bone marrow tissue that provide these basic orthobiologic ingredients that we can use as a treatment. And they can be mixed and matched in an infinite variety of combinations so that we can have many different recipes, many different scientific protocols that are used depending on what condition we're trying to treat. So the first biologic that was best studied is something called platelet-rich plasma. And platelet-rich plasma refers to the fact that when you centrifuge blood, it separates the different constituents of the blood. And the red blood cells, since they are the heaviest, they will settle to the bottom. And sitting on top of that will be a layer of platelets. And then above that will be a solution that contains no cells called plasma. And in that plasma are hormones and enzymes and different growth factors that are also shown to be helpful for healing. And when we treat a patient and make PRP, we are centrifuging their blood and then pulling out these different layers. And under the microscope, these cells look like this. So you're familiar with the red blood cell, which carries oxygen, and the white blood cell, which fights infection. But then you have the platelet, which originally was thought to be only important for preventing bleeding, so that you'd have a blood clot form. But it also turned out that these platelets are first responders to the injury, and they release growth factors that will attract other cells to the injured site and start that healing process. And some of these growth factors are listed here. You don't have to memorize them, but there are hundreds of them, if not thousands of them, that have been studied. And they each have very specific roles. So for example, the one VEGF there in the middle in red, that is a growth factor that specifically is designed to grow new blood vessels. And as you know, some of these tissues have trouble healing when there isn't enough blood flow to the area. And so by growing new blood vessels, you can promote healing by bringing more nutrition to the injured tissue. So PRP does heal tendinopathy or tendon tears. And there's quite a number of studies now in the published literature. If you count the number of scientific studies that have been published over the last several decades, you can see that every year there's just more and more studies. And they generally support, without exception, the role of PRP for tendon, and as well as some other medical conditions that we won't address in this talk. So the first condition in orthopedics to be studied with PRP was something called lateral epicondylitis, or commonly referred to as tennis elbow. Tennis elbow refers to the fact that repetitive use of the tendon at the elbow leads to degeneration and tearing. And we can see that tearing on ultrasound. So that image, that black and white image at the bottom, is showing the lighter part towards the top is the tendon, and the fibers are torn. You can see that black area where it says tendon tear. That patient has a tear in their tendon, which can produce pain and make it difficult for them to use their arm. And this has been studied, as I mentioned. There's a number of studies that show that the use of PRP for tennis elbow is effective. Including this multi-center randomized clinical trial that was performed by Dr. Alan Mishra, who was an orthopedic surgeon in Stanford, who was one of the first to use PRP for tendon injuries, in over 230 patients in this recent study showing that PRP is effective and has been shown to be as effective or more effective than surgery. And so this is what we see when we look with ultrasound. Actually, my first patient that I treated 12 years ago had this injury. This is actually his image. And when we scan with the ultrasound, we can see on the left, that lower left, we can see where the arrow is pointing. There's a black region where the tendon has torn. So we don't have very many fibers in that tendon. Whereas on the right, after treating with PRP, you can see that that tendon is regenerating. And the thickness of the tendon is decreased. It's less swollen than it was after injury. There are other tendons in the body that are commonly injured. One of them is the gluteal tendon, which is on the side of the hip. And if anybody's had injury to this hip tendon, they realize that it's difficult to walk, it's difficult to go up and down stairs. You may have pain when you sleep on your side, and your doctor who doesn't use ultrasound may think that you have a bursitis, and they may give you a cortisone shot. But what I've learned from using ultrasound for almost 20 years is that most patients don't have a bursitis. They don't have an inflamed bursa. What they have is a tendon tear, and that tendon tear can be treated successfully with PRP. In fact, in this study, which followed 80 patients for 2 years, PRP was more effective than injecting steroid into the tendon. Other tendons, other areas of the body include the plantar fascia, which is a tendon-like structure on the bottom of your foot. So usually patients will present with pain in the heel, and they have trouble first thing in the morning when they get out of bed. They have pain walking and bearing weight on the foot. And these can be very problematic and resistant to conservative treatment with physical therapy and orthotics. And PRP has been shown to be effective in a systematic review of 10 studies, as well as showing efficacy that is superior to steroid injections. As a matter of fact, we don't recommend injecting steroid into these types of injuries because it's actually detrimental, whereas the PRP has been shown to be effective. And there is a meta-analysis by Yang with over 400 patients looking at over 9 randomized clinical trials where PRP was compared to steroid, and showing that PRP is superior. Rotator cuff tears are very common. Anybody over the age of 60 has about a 60% chance of having a rotator cuff tear, so we see these quite commonly. It doesn't necessarily happen with injury. It could happen just through years of use. And in that ultrasound on the right, you can see a patient has a tear that's is demarcated by those little X's and is surrounding a black region. That's the tear in the tendon. And then you can see in this patient 2 months after receiving a PRP injection, that tear has resolved. That black area is now replaced with white collagen fibers, and that tendon is functioning normally again. We treat other areas of the body. This is just here for completeness, but we do treat knee osteoarthritis. Matter of fact, there are probably more clinical trials on knee osteoarthritis than there are on almost any other part of the body. We have more than a dozen meta-analyses, systematic reviews, very high-level evidence showing efficacy. There are also studies that show that PRP is effective for degeneration of the discs in the lumbar spine, as well as for other tendons in the body, such as the patellar tendon in the knee. So we make the PRP by a variety of different methods, but you can actually watch these methods. We have these videos on our YouTube channel. So if you go to YouTube and type in the name of our company, San Diego Ortho Biologics, you will pull up a number of videos, of which some of them here show you how we make different cell-based therapies using either bone marrow, PRP, or fat tissue. And basically with PRP, it's a simple blood draw, and then it's centrifuged, and then the layers separate as we talked about earlier, and you can see here the PRP in the middle section there, just above the red blood cell layer and below the plasma layer. And we can vary it by different ways. For example, we could make a PRP that has a lot of red blood cells and a lot of white blood cells. That might be helpful for perhaps an infected wound or a very high-grade tendon tear, versus making the pure PRP, which you see on the right, which is more of a yellow color, and that's more for anti-inflammatory purposes. So if a patient has an inflamed knee joint, for example, and then there's an intermediate type in the middle of that orange, which is low in red blood cell, low in white blood cell. So there are other cells that we use from tissues, and Dr. Ambach is going to tell us more about those.
Stem cells is a popular topic, and this has generated a lot of interest. You have likely heard about these cells from your friends or your neighbors, or have probably read about them in the papers or seen them in the news. So what are these stem cells? If you recall in your biology, these cells undergo cell division and makes copies of themselves to support development and growth. These are our typical cells. The stem cells are unique in that they not only make copies of themselves, they also differentiate into other cells. There are two main types of stem cells. The first one is called embryonic stem cells, and these cells are derived from embryos that develop from eggs fertilized in the laboratory. These are used for research purposes only. We do not use embryonic stem cells in our treatments. The second type of stem cells are called the adult stem cells. The adult stem cells are found in our tissues, and they can generate into different cell types for the specific tissue in which they live. In orthopedics, we're interested in specific adult stem cells called mesenchymal stem cells, or MSCs. And that's because these cells can differentiate into bone, tendon, cartilage, or muscle cells. Dr. Arnold Kaplan is a professor of biology at Case Western Reserve University in Cleveland, Ohio, and he has been named the father of MSC. He discovered and named mesenchymal stem cells, or MSC, more than 25 years ago. So where do these stem cells live in our body? They have discovered that these mesenchymal stem cells are found in small vessels or microvessels and are called pericytes. When there is injury or through appropriate stimulation, these pericytes become MSCs and they initiate the healing process. So how do these stem cells promote the healing process? These MSCs, sometimes we call them mobile drugstores, and that's because they contain a multitude of molecules that are involved in healing tissue, controlling inflammation, and fighting infection. For tendon injuries, These cells help repair the tendon tears. They help increase the tensile strength of the tendon, help decrease inflammation, and help with pain. So what kinds of stem cells do we use in the clinic? We use cells that are derived from a patient's own tissue, specifically bone marrow and fat or adipose tissue that are not processed by enzymes. These treatments are compliant with current FDA regulatory guidelines. Cells that are derived from birth tissue products, specifically amniotic tissue and umbilical cord blood, are currently not permitted by the FDA. We do not use birth tissue-derived stem cells in our clinic. The safety of these birth tissue-derived cells have not been proven, and so is the efficacy of these products. In fact, there's cases of bacterial infections that have been reported in patients who had received these treatments. Our colleagues tested these products, and they have shown and confirmed that these products do not contain live stem cells. So you have to beware of clinics that advertise birth tissue products containing live stem cells. These products require FDA approval of a biologics license before they are allowed to be marketed to patients. The only cell-based therapies that are allowed by the FDA at this time are platelet-rich plasma or PRP, bone marrow-derived cells, and adipose tissue-derived cells that are not processed by enzymes. So are these therapies safe? There are many safety studies that have been published in literature on the use of these cell therapies. These are some of the important safety studies that showed that there's no serious adverse events and no increased risk of cancer in the use of these cells from bone marrow and adipose tissue. So what's the evidence for the use of these cell-based therapies for tendinopathy? So as Dr. Rogers has shown, just like PRP, there has been an increase in these studies and published literature on PRP and also on stem cells, especially as you can see here in the past 10 years. This is a study that showed that bone marrow cell therapy decreased the disability and pain in the patients that are enrolled in the study, starting as early as 1 month, and these clinical symptoms improve up to 2 years after treatment. This is another study that showed that when adipose tissue cells were injected in partial rotator cuff tears, there was significant reduction in pain. There was improved outcomes, which means they have improved clinical function. And also when they did MRIs of these patients before and after the treatment, they have shown nearly 90% reduction of the defect on MRI in these patients that received high volume or high count of these cells. So you can see on the bottom of the slide here, the yellow arrow is pointing towards this white bright signal, which is indicative of the rotator cuff tear. And over several months, you can see a decrease in the signal, which signifies a decrease in tear and improvement of the injury. In the same study, they also took arthroscopic pictures of these tendons. And arthroscopy is when they insert a small cannula with the camera at the tip into your tissue or to your joints, and you can see the structures very clearly. And you can see on the right here, the regenerated tissue they found was glossy and it has a smooth surface, and it also had firm characteristics, which are all similar to characteristics of a healthy tendon. They also showed decrease in the size of the defect and the tear after the cell therapy treatment. This is a study showing bone marrow cell therapy also improving pain and disability when used for tennis elbow, just like in the PRP. We tend to favor these cell therapy treatments when the tendon injuries are more severe. There are also studies showing the use of bone marrow cells for Achilles tendonitis. This particular study enrolled 21 patients with more than a year problem with their Achilles tendon, and they have failed physical therapy, anti-inflammatories, and cortisone injections. After one injection of bone marrow cell therapy to their Achilles tendon, they've shown that these patients had significantly decreased pain, and it was also shown that the procedure was safe. There was no complications at the injection sites. This is what an Achilles tendon tear looks like on ultrasound. On the top here, you can see a black region at the center of the image, and that is the tear in the tendon right at the attachment of the heel bone. And on the bottom here, you can see that this black region is filled with these white lines, which is the fiber tissue. And you can see resolution of the tear after treatment with the cell therapy derived from fat. This is an actual patient of ours in the clinic, and this particular patient is actually a professional soccer player, and he had a pretty significant tear in his patellar tendon. The patellar tendon is the tendon that connects the lower portion of your kneecap to the shin bone. And as you can see, after just one injection of the fat-derived cell therapy, at 3 months, you can see resolution of the tear and significant clinical improvement for this patient, such that he was able to go back to playing soccer with no problems. This is another patient of ours with a lateral epicondylitis or tennis elbow. Again, huge tear in her tendon. And after one injection with fat-derived cell therapy, you can see a resolution of that black hole or the tear, and the tear was healed as early as 3 months after the injection. And he was back playing pickleball, and I was very happy with the treatment. This is another patient of ours who was a professional golf player, also had a significant tear in his rotator cuff and received adipose tissue cell therapy just one time. And after injection, he actually went to win the tournament 8 weeks just after the treatment. And this image on your right here is an ultrasound image of his tendon 1 year after the injection. So you can see a healthy looking tendon with no black signals, which was the area where the tear was. Now is being covered with this white tendon fiber showing resolution of the injury. There are other orthopedic conditions where stem cell therapy is used. As Dr. Rogers has mentioned, this is also used for joint osteoarthritis, ligament injuries like ACL tears, bony injuries, and degenerative discs in the low back. Patients often ask us if they are too old for stem cell therapy. And although there is data to show that stem cell counts decrease with age, we don't really know at this time what is the ideal number of cells or count of stem cells to treat a particular injury for it to be effective, or if there is such a thing as ideal count. We have treated a number of these patients in their late 80s and some even in their early 90s who have benefited from these treatments. This is a particular study using adipose cell therapy or fat-derived cell therapy for osteoarthritis in the knee in the elderly. And they have shown that 80 to 92-year-old patients obtained benefit from the therapy. So during these times where we have the coronavirus pandemic, it brings us to a realization that we need treatments that will actually work, enable for us to be able to function better in life. And Johns Hopkins University actually recently conducted an analysis, a simulation-based analysis on elective orthopedic surgery cases due to COVID-19 restrictions. And they have concluded that it will take 7 to 16 months, about a year, for the healthcare system to reach 90% of their expected forecasted volume of orthopedic surgery. During these times where there are limited treatment options, likely even delay of surgery cases, patients will need more than ever effective non-surgical treatments to treat their orthopedic problems. Cell-based therapies such as these are an important alternative solution to fulfill these needs. Only certain qualified physicians with the proper skills and training can provide these therapies. These physicians are board-certified physicians who are specialized in diagnosing and treating orthopedic conditions. They have advanced training in performing these procedures under imaging guidance and have the skills and experience in knowing what's the best regenerative cell therapy for your specific condition. You want to see clinics who are compliant with FDA regulations and, most importantly, who care about achieving the best results for their patients. Speaking of achieving the best results for patients, this is a regenerative medicine registry that we use in clinic. It's called Data Biologics, and this is co-founded by Dr. Rogers. It's a cloud-based registry that's very patient-friendly and easy to use. And through this, we can track our outcomes and give our patients real data on our outcomes with these treatments. And it's important to collect this data not only to track our outcomes, but it's also useful to guide future decisions made by insurance companies and regulators. So that concludes our lecture portion. Thank you everybody for listening. If you missed anything, this webinar has been recorded and will be made available to you. And if you are interested in more information or research articles or even more videos, you can check out our website or our other social media sites for more information.